Welcome to the first webinar in our two-part series on supporting young children's social development following the COVID-19 pandemic. In these webinars, we're going to explore the experiences and impacts of the pandemic on young children and share some simple and effective ways you can help your child's social development. SDN has supported many children to return to or begin in our services since the first lockdown of 2020. With some care and attention to their social and emotional needs, these children are engaged and thriving in our services. The suggestions I'll share with you in these webinars aren't just useful for children who've experienced lockdowns, but for all children, all the time. Children's early experiences build their brains. Their social interactions are important because these, and the relationships that develop through them, help to shape children as people and teach them about the world they live in. The COVID-19 pandemic significantly disrupted young children's lives for the better part of 2 years and exposed them to lockdowns, social isolation, increased parental stress, and in some cases, financial hardship. In our long daycare centres and preschools, SDN staff have had many conversations with families about the impact lockdowns and isolation has had on your children. And while research is limited into the impacts of COVID-19 on children under 5, some studies reinforce the stories you've been telling us and our own experiences as we transition children back into early childhood education and care. Some of the impacts families and educators have noticed as a direct result of lockdowns include an increase in challenging behaviour and moodiness, increased attachment-seeking behaviours like clinginess or anxiety, hyperactivity or inattention, more screen time and less physical activity, changes to sleep patterns, and of course, increased stress at home while families juggle work and parenting, financial pressures, and a loss of support from family and friends. For children with autism or other additional health or developmental needs, a lack of things like face-to-face speech or occupational therapy exacerbates these other issues and have worsened the impact on some of these children even further. Public health measures across Australia have largely been lifted now, but many families are left wondering about those long-term impacts of the pandemic. How will children cope with all the new faces and relationships they'll encounter? Will their social development catch up after this long period of restrictions? Well, the good news is, children are pretty resilient. Put simply, this just means children overcome or bounce back from challenges quite easily and don't let these challenges get them down. At SDN, we think resilience is one of the most important attributes for a child to develop. Our educators and therapists make plans to build resilience, and there are things you can do at home to promote it as well. For children to have the best chance of being resilient, we have to begin by making sure all their other basic needs are being met. The most important of these is having a strong relationship with an adult, and we'll talk a lot about attachment in our next webinar. So what else does your child need to build resilience? Predictable routines so they can relax into daily rituals and play and develop their memory. Plenty of sleep and a healthy diet. Children who are tired or hungry are much less likely to cope with the smaller struggles of the day without a meltdown. And plenty of active play. Children need a lot of physical activity every day. Active play, especially in nature, has many benefits, including a really positive impact on mood. To build resilience, families and educators can do a number of things. Avoid solving every problem for your child or rescuing them when they face small challenges. Give them a chance to overcome the struggle for themselves. Talk about feelings often, your own, your child's, and other people's. let your child see you being resilient. How do you move on from mistakes you've made or a sudden change of plans? What does your child see you do when you face a challenge? And play games. Turn-taking games and other games with rules build patience. Games of chance like dice rolling games are a great way to build resilience. Don't be discouraged if your child can't cope with losing at first though. You can begin by allowing them to win and promote resilience by modelling a calm response to your own loss. In our next webinar, we'll build on resilience. We'll look at some simple ways you can help your child's social development following the restrictions of the COVID-19 pandemic and help them cope with all those new faces and relationships they're encountering. See you then. The Centre for Community Child Health, Murdoch Children's Research Institute's report on the impact of the COVID-19 pandemic on children in Australian early childhood education and care informed some of the content of this webinar. For more information on resilience, the impacts of COVID-19 on young children, or about SDN, check out these resources.